It's my honor to introduce Lisa Walls as one of our guests today, as one of our seminar speakers. So she's being hosted by the Command Corps, our stats group. And so Dr. Walls is an associate professor in the Department of Family Medicine and Biobehavioral Health. She received her PhD in sociology from the University of Nebraska-Lincoln. And so last night, just Lincoln, Nebraska everywhere. I mean, I was just inundated with Nebraska. I don't know. So Dr. Walls' research involves community-based participatory research with American Indian and First Nations communities. Her tribal affiliation is with the Boys. I was trying to be fancy with French. The Boys Fort and Couchiching First Nation Anishinaabe. So a theme in her work is it's collaborative. It's to understand the historical and contemporary social determinants of health for Indigenous individuals and families. Her current projects and previous projects include funding from NIH and the Public Health Agency of Canada. And so we've invited her here specifically to talk about working with Native communities on research, how do we measure things, how do we understand adapting research for Native communities. So welcome, Dr. Walls.
Well, thank you. Thanks for the clapping. So I do have my mic. I do have a secret alter ego that I love Celine Dion, and I just, whenever I did a microphone, I wanted to do a Celine Dion move, but I'll spare you. Miigwech, thank you for that awesome introduction. You heard all about me, but I'll tell you that this picture of the ice is what we see in Duluth, Minnesota, which is where my university is and where I live now. Right now on Lake Superior, that ice is breaking up. It's starting to get warm. There's signs of spring. But it's also very beautiful. The blue, it feels like the movie Frozen. It's just that beautiful blue color right now. But I grew up way north of Duluth, 2.5 hours north of Duluth in International Falls, Minnesota. Anyone ever been to I Falls? You have?
I'm from Minnesota, so.
Oh, so why did you go to I Falls?
Vacation, like vacation.
That's awesome, because we have a beautiful lake called Rainy Lake. And Rainy Lake is where many generations of my ancestors on my mom's side lived. And that side of the family is the Adams family. So if you know any Adams family members in northern Minnesota, they're probably my relatives. And we're also the Sinclairs and many others up throughout Canada. And there's an area on Rainy Lake called Blind Indian Narrows. And that was named after my great-great-great-grandfather, because he was blind, and they decided, well, he lives here, let's call it the Blind Indian Narrows. So if you ever go to Rainy Lake and go through Blind Indian Narrows, that's my ancestor who inspired the not very original name. So that's a bit about me. I am in Duluth. I'm on a satellite campus of the University of Minnesota Medical School, where our mission is for rural and American Indian health. So I landed in a place that gets me close to home, close to the tribes I work with, close to my tribal communities, and close to, well, away from the bustle and hustle of the Twin Cities, which is ideal for me, for my personality. All right, so I'm going to talk to you today, as we mentioned, I have multiple microphones going on. I'm going to talk to you today about measurement, and I'm going to draw from largely these 4 projects. I won't go into detail on these, except to say that the first project that you see, Healing Pathways, is a longitudinal epidemiological study of about 750 Native kids from Canada and the US that we have been following since they were about 10 years old. So we have currently 8 years of data from age 10 to 18 on those kids and their parents, and now they're in their mid-20s and we're collecting data from them again to figure out, what are the trajectories of substance use, mental health, and actually positive things, resilience, positive outcomes for these kids. And this has really, I think, pushed us to innovate on how we measure risk and protective factors for our communities. So I'll share some lessons from that. That fed into Bizendarida, which is a drug and alcohol prevention program for families that is based on the data from Healing Pathways. So some measures, I won't touch on those as much today, but the final 2 projects are around diabetes, mental health, and stress. And so our team has been, for the past, 9 years or so, working with communities to try to figure out the psychosocial aspects of type 2 diabetes that we can intervene on to make life better for the many individuals in our communities who are living with type 2 diabetes. So I was telling Dr. Hansen this morning that I actually get a little annoyed about the outcomes. I'm not so much interested in, is it substance use or diabetes, or in our communities right now, opioids, or killing our communities at 7 times the rate of non-Native communities in Minnesota. Minnesota is a hot spot, and it is considered the highest disparity state for opioid overdose. But these are all symptoms, as one of our elders said, of our main problem. And for our research team, that main problem is rooted in historical trauma and how those factors have led to contemporary health disparities. And so for me, what I want to just, the message and the lens and the, I guess the bias, if you want to call it that I have in all of this work, is that the work is a social justice issue. It's, even if I'm not measuring components of historical trauma, and I will talk about that, it's in the background of, this is all about promoting social justice and promoting the best health that all of us can have. The second bias that I have, and I hope that by the end of this you'll agree with me on this, is that the work that we do with Native communities has lessons for the entire world. It's always the opposite, isn't it? That the work with majority communities informs everything. Well, the work with Native communities, Latino communities, rural communities, whoever you're working with, has huge implications for all research. And I'm going to give you some groundbreaking report information, that's not from me, I didn't write it, but some information at the end that you could cite just to remind yourselves that we don't have to constantly be, oh, that special group working with natives or with rural or with, and I think you, where you live, and the work and the mission that you do as a group, probably you agree, I hope, but be proud of what you're doing and what our communities are offering the world, because it's pretty awesome. And we're actually further ahead than a lot of other groups. So I'm just gonna put that little straw in my hat and we'll get back to it. Okay. Cannot tell you that this is my work. This is our team for one of the diabetes projects. This is us with all of our jackets on. You know, we're really a team. And these are the folks out there collecting data, living in their communities, bringing the data back to the tribal councils with us. I'm just the spokesperson. I get to travel to exotic places like here and share our findings, but it's not about me. It's not about me. It's about these guys and these guys. This is at an honoring event for our community research councils. Some people call them advisory boards. We think of them as more than advisory groups, so we call them community research councils. We did an honor event for them for many, many years, actually 18 years of work on the Healing Pathways Project so far. Oh, I have to tell you, the woman, if you can see her up in, for you, the upper right in the yellow, that's my grandma. She came to check out the honoring event. And here are the current Healing Pathways interviewers. They're out there, and the smallest little baby Maddie in the front collecting data from the kids in their mid-20s, young adults in their mid-20s. All right, so all of that background, had to get to know you, let you know who I am, culminates with these goals for what I'm going to share with you over the next bit of time today. One is, I hope that we can identify together, and I invite you to just interrupt me and give your examples, some of the tensions that we might be feeling as research scientists working with Native communities when it comes to measurement. Now, my primary tool is survey research. I'm a sociologist, and I feel like sociologists are the kings and queens of surveys for some reason, and so we use surveys all the time. But you know, you can think about measurement in other ways. You can think about it in devices or in things in fluids or blood or saliva. So lots of ways to think about it. I want to discuss in brief, but in, I hope, pretty profound ways, some of the implications of mismeasurement. And I'm going to share with you this wheel that we have created that is not anything groundbreaking. I smile because I feel like it's a little bit silly, but actually it's a useful heuristic for thinking about how do I put all this together when it comes to approaching a new project, and give you lots of examples as we go. All right. Some of you may know the speedwork pattern. It's, well, not the pattern, but actually the orange bead amidst the blue is sometimes called a spirit bead. So when people do beadwork, I was always taught, make one bead a different color on purpose because nobody's perfect but the creator. And that's a reminder that you're not perfect. And for me, I don't really need the spirit bead because my beadwork is not perfect by any means. But I say this to express to you a lot of humility about everything I don't know. And you all have a wealth of experience. So I'm not here today to talk about applications of item response theory and other psychometric evaluation techniques. That's not what the goal is. I'm here to talk about process and kind of hands-on practical things. I'm not going to give you a methods 101 on survey design. That's a different talk. I'm not going to give an exhaustive review of measurement approaches, but I can give you some tips on where to find some. And I'm not going to tell you that you should or should not even measure certain things. So should you even try to measure spirituality? That's not really up for me to decide. That's your community team, right? So lots of humility in how I go forward here. All right, so I want to hear from you. You all, how many of you have done, let's say, survey research? Raise your hand up high. Big chunk of you. Or really you could use any kind of method, but in the research that you do, have you ever used a measure you didn't trust? I'm seeing like everybody's nodding. Who wants to give me an example of, and we can hear a couple, what worried you about it and what was it?
Well, for our choices intervention, we piloted it with a Native community, and we got feedback from our interventionists that women weren't getting certain questions. They just weren't understanding it. And so we approached the original PIs of this intervention with this issue, and they said, well, you can't change this. You can't change, it'll change the validity of the intervention and the question. And so that was kind of an eye-opener for me of a lot of pushback of you know, the community's telling us that they don't like this, they don't get this, we need to change this. But then the scientists are telling me, well, you can't do that.
Do you remember what it was? Like, what was the construct? Do you remember?
It was talking about, so one of the things we measure is temptation, confidence to drink alcohol. Like in certain situations, is this tempting for you to drink? Are you confident that you could avoid drinking? And it was just some of the phrasing in there. Mm-hmm. It wasn't anything I didn't feel. And we ended up doing a validity study and we changed them. And I don't feel like that took away from the original intent of the question, personally.
Good example. Ariel, did you have one minute?
Every time I do a study on peer influence of alcohol or substance use using the Ad Health survey, I die a little inside, but I still do it because the only thing that you can use is this one freaking question that says, how many of your 3 best friends drink at least, once a month? And it doesn't say anything about how much you drink with your friends. It doesn't say anything about, do they binge drink? How are they drinking? We have all of these measures that talk about how the individuals drink, and yet I have to use this extremely rigid, stupid measure that, I've published a few papers on, and I'm still like, yeah. Mm-hmm. But that's the way most of the literature, that's what the literature uses. How much do your friends drink? Right. So that's peer influence.
I'm sorry that you die a little every time. And there was a hand up over here, I thought. One of you guys in the blue? It's looking at the computer now, so I'm calling you. You want to give an example? Okay. Well, those are 2 good ones, right? And we could go on and on, right? And so whenever you have that gut feeling, I would urge you to think about it and maybe take some action on it. And I'm going to give you some examples of ways that we've taken action because of what is at stake. So this hopefully is old news to most of you. At the basic level, if we don't measure, let's say, outcomes correctly, we might be misspecifying a rate of a disorder. We might be misspecifying the extent of a health problem, which can, in the best world, our research informs policy and services, right? I know that's not always what happens, but it could impact services. It could, especially in tribal communities where we translate data back, it might change the way that people think about a problem in an incorrect way. There's also the issue of labeling and stigma. If we do things in an incorrect way, we can draw incorrect conclusions about how a program works, which is, of course, problematic in scarce resource settings like tribal and rural communities. Also, the meaning and the impact of certain constructs. What does it even mean? What does 3 best friends drinking even mean, for example? What does the construct about intention to drink mean, or pressure to drink mean? Also, this saying that I think I've said it like 15 times in the past week, you are what you measure, is so important. So many of you who work with tribal communities have heard the story about, or maybe have heard your community partners say, we don't want to keep measuring these negative outcomes. We want some strengths-based research. We want some positive stories here. I've been hearing that for 20 years, and yet we kept measuring negative outcomes because what gets funded? Drug abuse, not abstinence, right? And with some exceptions, you can be a little clever in the way you phrase your applications. But we did start about 10 years ago measuring, maybe 8 years ago, measuring completely positive, no strings attached outcomes. As an example, the Positive Mental Health Continuum, short form, which is a measure of whether or not you are flourishing in your mental health status or you are languishing. Now, languishing is a bit negative, I realize, but the point of it is flourishing is a positive state of just psychological, emotional, and social well-being. We measured this and we found that our communities were off the charts compared to any other published report of this measure I could find in flourishing status, yet simultaneously had high levels of psychological distress. That may seem paradoxical to you. To our communities, it was like, yeah, you can be both. You can. And actually, the literature around positive mental health says, in fact, you can be both. They're not, you know, they are separate constructs. They're related. They're inversely correlated, but you can actually, in some cases, have high levels of both. So you are what you measure. All this time, we've been talking about the distress in the community. We had been leaving out this picture of positive well-being. And let me tell you how our tribal community partners' energy shifted when we showed that statistic. It was a whole new land. It was a whole new world. And it's something that I didn't believe even myself when I first did it, so we replicated it in a separate study. Lo and behold, found actually a little bit higher rates in the second one. Partnered up with some people at the University of Washington who used a similar measure and published our data together to say, folks, you are what you measure. And if you measure something positive, guess what? You're positive. And if you measure something negative, guess what? You're negative. So I think this relates to the issue of what you measure in very deeply profound ways. And most profound to me is this meaning of culture. So how many of you have heard of our culture is our medicine, our culture is our treatment, our culture is our prevention? Does anyone see some heads nodding? I hear this all the time in my communities, my community and the communities I work with, and I just hit the number one, but nothing happened, okay. And so what do we do as scientists? We try to measure that, right? And I'm going to talk about how do you measure culture in a bit, but I want to tell you what the implications of trying to measure it have been. This is a picture of my Auntie Pam in the white sweater. There's my grandma next to her, and my uncle and my auntie. So my Auntie Pam works for the Minnesota Chippewa Tribe, which is an umbrella organization of the Ojibwe bands minus Red Lake in the state of Minnesota, okay? At the time, she was working for them. Now she works for the Boy Sport Band. She was told by the state, who had funded a prevention program, you're telling us that culture is treatment, culture is medicine. We need evidence of that. Evaluate it. She called me in tears, actually. They're trying to get us to evaluate our culture. There was a misalignment between what the state was saying and what my Auntie Pam was feeling, and it was killing her. It was hurting her. She didn't understand. And then so when I explained to her what I thought they meant, she said, well, how do we measure culture? Right? This is something we all grapple with, and I'm going to talk about it more. There's that. Here's Arlene La Liberté. She's a First Nations researcher in Canada. She let me use her picture. Beautiful picture. Arlene was collaborating with us on a suicide prevention grant in Canada. We were sitting around a table just like these ones. It was myself, Les Whitbeck, Lawrence Kermayer, who's a well-known Canadian psychiatrist, transcultural psychiatry journal editor, yada yada. Fancy people, and me. And Arlene and some other Indigenous researchers. And we have to measure culture. So Les's team had come up with some measures of culture that I'll show you in a bit. One of them was a checklist of engagement in traditional activities. So how often do you go to ceremony, sweat lodge? How often do you go to Midday Lodge? How often do you sweat? I already said that. How often do you give out tobacco? How often do you smudge? How often do you go to a community feast? The list goes on. Spiritual activities, traditional activities. We had both. Arlene, again, the person across the table, in tears at the end of reading this measure. She said, I live in Montreal. I am an urban Indian. I have been my whole life. I don't have access to a lot of these things, so what am I? Am I Indian anymore? What am I in your measure? It was killing her a little inside, right? Fast forward to Mike. Mike is one of our community interviewers at Boy Sport for the diabetes projects. He was reading that very same but modified checklist in a study that we were doing on diabetes and mental health. He was doing computer-assisted personal interviewing with an elder. He was sitting across from the elder. He was reading the checklist, just like I said to you. How often in the past year have you offered tobacco? How often in the past year have you? Elder's answer on each one of those was no, never, 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 never. The end of the measure, Mike looked up just to look at his participant, and the elder was tearing up, and he said, I guess I'm not much of a man, am I? Oh, when I heard that, it was like someone stabbed me right in me. I did die inside. And I thought, what are we doing? What are we doing? So, with the best possible intentions of showing the protective influence of culture, and with lots of community feedback on how to measure it, you still can screw it up. So again, humility, but just, I want to give all of that, I know it's a little bit lengthy on the context, but it just drives why it's so important. It's more than science, right? It's more than our grants, it's more than a lot of things. Okay. I put clip art in there for Michaela, because she loves it. That's a joke, she hates clip art, in case you didn't know it. I don't even know if that's not quite clip art, I don't even know what that is, but it's the best I can do. So some of you may have read this kind of classic article now from Jan Beals and the Colorado group about cultural specificity and measurement versus comparison data in psychiatric epidemiology, and they called it walking this tightrope, and I think that's what you were describing, Jessica, and trying to measure outcomes. Do we want specificity or a measure that is culturally specific, that's really going to be culturally valid, or do we want a measure that is going to allow us to generalize, and that maybe not even generalize, but compare our findings to another group, right? So both are important and valuable. The comparison piece, if I hadn't used the positive mental health continuum short form as it was, I couldn't have compared and said, wow, look at the high rates in our community compared to your community. Na, 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 right? I couldn't have said that because I would have changed the measure up a bit. Or could I? You know, I think there's some measurement work to be done to demonstrate equivalence even when you tweak things just a little bit, because I think that's, like you were saying, Jessica, I think that's possible. So this undergirds this issue. So what happened was, and I just want to pause for a second. I don't think that clock is working.
No.
Is there a timekeeper? Are you my timekeeper?
Yes.
Can you tell me when I'm at like 20 minutes left? Because I want to make sure I leave time. Okay. Somebody tell me 20 minutes.
Right.
So what happened was, over the past, I would say 5 years, I would go to, we all go to conferences, and I hang out with my same old friends at these conferences, hopefully meeting new ones now. But some of my friends are listed here, and some of them you may know. Nancy and Michelle are both at Colorado, and I think have worked with your team, some of your teams. Allison Barlow is the director at Johns Hopkins Center for American Indian Health. And at these meetings, over and over, we would be talking about these measurement issues. And we would say to our program officials at NIH, actually, why won't you just fund a measurement project, just measurement, because it's not a health science issue, right? Well, it is, but they don't want to fund just measurement. So we put together a little work group, and actually kind of like a think tank of researchers. We met in DC and we talked about all kinds of issues, many of which I just brought up, trying to come to some sort of framework or conclusion about how do we proceed with this mess. This overwhelming feeling of mess. And especially for us, we were really hoping to figure out ways to measure culture, quote unquote culture, I'll talk about that, in meaningful ways. I would say we came up with some interesting conclusions from that meeting, but nothing that made me feel like, yes, we got it. So fast forward a year, and Kathy at NIDA said, why don't you guys just write up some of these ideas? We'll commission the report and write it up and see if you can get it published. So we did, and it did get published. And Jessica read it and said, come and talk about it. So that's why I'm here. Don't get caught up in this crazy wheel. Yes, this is the best we can do with our clip art or whatever, word art, whatever you call it. It has a lot of moving parts, and I'm going to walk you through all the parts now in brief. And don't get caught up in memorizing the wheel or worrying about the wheel. It's the concepts and the process that are important, okay? If it's useful, use it. If it's not useful, ignore it. Okay. So, Nancy Weitzel did that, not me. It spins. What you can't do in a journal article is make something spin. You can't do it in PowerPoint. So in all measurement development, especially for surveys, I guess maybe just for surveys or other forms of assessment, we go through a cycle of measurement development. And in sociology, many of the textbooks talk about it in this way, psychology as well. Many of the social sciences say we start with conceptualization, brainstorming. What do we want to measure? What are the things that are relevant? For us, often that's in collaboration with our community team. What do you think is influencing the problem? What do you think is a protective factor, right? So that's conceptualization. Next, you move to actual measurement, operationalizing the thing. You write out an operational definition, you create a survey measure, you create an assessment tool, whatever it is. Then you have to implement it. Am I going to do a survey? Am I going to do a focus group? Am I going to ask you to step on this scale that I made? Am I going to take your blood? What is the implementation of that measure? And then we interpret it. Now, historically, the interpretation has been the investigators sitting at their typewriter or their whatever they had, and interpreting their findings. I think for us, this is another place where we're pushing envelopes, I hope, as Native scholars and allied scholars, is we interpret with our community partners. I think it brings a richness to that interpretation that maybe we miss when we're stuck in our institutions, right? Okay, so that's the cycle on the outside. What we wanted to think about, though, was that wheel of specificity on the inside. So everybody goes through some sort of measurement process. You might not think about it or label it in the way that the outer wheel does, but you go through these steps in some form. And then what we grapple with when we do, I would say, non-majority research is what we've been talking about. Do we need to tailor the measure for the context, for the community, for the culture, for the whatever? So we thought about this inner wheel that could also spin, right? That could spin around, and you could be more or less specific at each level or each step in the measurement cycle, right? So you could start out with common, and we use the word common to denote measures that you're going to find in the literature. So you talked about this choices measure. We labeled it common. We didn't want to call it traditional, conventional, validated. We didn't want to give it the power, I guess. So common was the word we came up with. And what we're trying to say is it's common because it's out there. And then people, so this ad health measure that was brought up, where do other people find measures? Well, they go to a big survey and see how they did it. So we replicate each other over and over. Now, that's actually a powerful thing in science. It's a good thing, but I think it almost has stifled us now as scientists. So I was freed by a talk that I'm going to mention at the end of this by David Henrie. So we'll come back to David Henrie in a minute. So common measures. And sometimes common measures are just fine. Your community team, you as a scholar might decide that's what we want to hit. That's what we want to measure. Positive mental health, that looks good. Community said looks good, let's use it. So we don't always have to make things up on our own. It's good to use common measures sometimes. Or maybe we decide, okay, that common measure of depression, yes, it's been used all over the place. This PHQ-9, this CESD, this whatever. But maybe we've been learning that there are dimensions of depression for many Native communities, maybe a pan-Indian kind of thing, like loneliness, let's say. And this is just all kind of made up, although based loosely on empirical evidence. Maybe we want to just tweak those measures a little bit for the entire American Indian Alaska Native population. Maybe, maybe not, right? So we might want to think about that while we're conceptualizing, or when we're writing the measure, or when we're implementing, or when we're interpreting. Or maybe we want to get even more specific. So now I'm not just a pan-Indian measure, but I'm a measure that is central to Lakotas, to Anishinaabe or Ojibwe people, to Choctaw people, et cetera, right? So that checklist measure that I talked to you about of spiritual and traditional activities was made for Anishinaabe people. It is not going to work for Lakota people. You would want to tailor that if you even think it's worth using. After what I've told you, maybe not, right? But we got one more step here. You could even go so far to say for that specific American Indian community. So in the Healing Pathways study, 8 different Anishinaabe communities. Are those 8 communities exactly the same? No, my goodness, they are not. Some are much more similar than they are alike, but do we need to adapt measures in our survey? And we do this in Healing Pathways because we have Canadians and Americans. There are some things that just don't translate, literally. So we might need to tailor to the specific community. The thing is, all of that feels, you can imagine, both wheels spin, so you could go, where do I go? But what eases the scariness of this for me is that we have community researcher partnerships, and that's what drives this wheel, the push and the pull of the wheel, right? So our community teams, we're researchers, we're community members, we're working together to decide, where do we feel comfortable across each of these, right? You don't even have to use this silly wheel. Just thinking about it, where do we feel comfortable? Does that sit right with us? And then comes in the hard measurement work that you sometimes do. So as a last kind of hurrah of Nancy Whitesell's awesome PowerPoint skills, this is just showing you how that wheel can spin. So at conceptualization, maybe we decide to do something using common conceptions of depression, of parenting, of substance use, whatever. Maybe at operationalization, our wheel lands on tailoring. you see the wheel goes on and on, okay? So it could go in all kinds of combinations. This is where you should be. This is a lot to think about. And this little wheel, mighty little wheel that we tried to come up with, we struggled to even come up with some sort of a picture to try to think about all of the ways that this impacts our day-to-day work. So I think two important things. One is this takes time and this takes money to do. We don't all have that luxury. Also, there are situations when thinking through measures and conceptualizing them and interpreting them is not an appropriate response. For example, when a community comes to maybe a researcher and says, we want help on the issue of suicide clusters, probably you need to just get to work, right? Like there are certain things you just need to move forward. So it's not to say that you always have to think through adaptation for everything, but there are places where it could be useful. So where I want to kind of take it now and wind up with is the examples, because I think examples are what brings it home. And I'll also show you how it's not like a clean mapping it onto this wheel thing. The wheel, again, is just a heuristic, just a way of thinking. But in real life, it gets a little bit messier. All right. So just as a simple example, many of us are interested in substance use research. I know many people here. And our team is interested in really reducing substance abuse, right? And one way you can do this is thinking about intervening on early onset substance use with kids. Because the more we can delay onset, the lower the risk for later abuse. So what causes that, though? What's in the black box? What leads us to know that we can reduce early onset substance use? Well, we just so happen to have experts in this area, so we could fill up that black box pretty quickly, right? But one area, when you ask community members in my region, is, there's that word again, culture. And the word culture in Native communities takes on special meaning, I feel. It doesn't mean everybody, okay, first of all, everybody has a culture and multiple cultures. We have and live in this world with multiple intersecting identities every single day. It is very hard for me to get my white, rural Minnesota medical students to see that. It's very hard to think about that when you have a majority culture identity, I think. But you've got a culture, and if you want to see how weird your culture is, go somewhere where the culture is very different. You get to see how weird you are, right? So we're all weird cultural beings. So let's just throw that out there. But in Native communities, and it's really, again, I bring up Kathy Yates, who's a program official at the National Institute on Drug Abuse. She's always saying, when you guys say that, you mean something, though. You just don't mean culture. You're talking about, like, traditional stuff. You're talking about what you're calling traditional, pre-colonial even sometimes, stuff. You're not just talking about the modern culture of Native people. I am a Native person. There are many Native people in here. We're all shades of the rainbow, and we dress in certain ways. We go to Target. You know, like my friend Jill Dorfler says all the time, I shop at Target, and I'm Native. You know, so like we live in a modern world. But when we say culture, we're not talking about all that, right? So I think that's important to think about. So what our team has tried to do is think about how do we measure culture in that unique way, but also that encompasses the modern world that we live in. And can we tap into various protective mechanisms of that whole continuum? So to conceptualize this, so I'm still on the outer measurement wheel right now, I'm thinking about brainstorming. How do I measure culture? Felt like that was shaking for a minute. Did anybody see that, or was it like a weird mini seizure? Hundreds of definitions of culture, norms, behavior, shared, yada yada, okay? You can go to the literature for any group and learn how to measure or how to conceptualize culture. So why not? Like, people have come before us, let's learn from them. But again, there's that special, unique, or let's call it the particular meaning for Native contexts. So what are those particular meanings? Well, here are some qualitative excerpts from some of our focus group data from some elders and service providers. Often we hear people talk about identity. You've seen measures of cultural identity. We hear about those activities. Are you doing the cultural activities? But they're talking about traditional, like old, like pre-colonial activities that have survived or been reclaimed, right? So they also talk about language, reclaiming our language and using our language. And I'll never forget the woman who said, and this man said something similar, but when you speak Ojibwe Moan, you feel it in you. You feel something. It's not the same as saying it in English. So how do you measure all that, right? Or should you? Should you even try? Well, here's what we've done as a team. We kind of started with this idea of enculturation being a three-pronged thing, where you could measure separately things like language and knowledge of the culture, your sense of ethnic identity or Anishinaabe or Native identity. And identity measures are all over the place, let me tell you, right? And anybody can have an identity measure. I could give an ethnic identity measure to all of us, right? No matter our ethnic background, and see where we score. Just tell you, think about your ethnic identity, right? So there can be common measures of these things, or they can be very culturally tailored on that wheel of specificity. So identity and then practices, like are you engaged in those activities that we talked about? So historically, our team has used all three of these types of measures, and then we standardized them into a single scale called enculturation. And we have had some success in showing that these variables are related to positive outcomes or the reduction of negative outcomes. But because of things like Arlene's story and Mike's story that I shared with you earlier, in our recent work, we've been really trying to broaden the way we think about culture. And this is all through conceptualization with our community teams and then getting to these actual operational definitions, these measures. So we're using things like, do I feel a sense of belonging in my community? Do I feel a sense of purpose that is rooted to this culture? So in Anishinaabe communities, there's a saying that you'll hear over and over called Minnow Bamanzwayan, living a good way of life. And the intention behind that is not just I'm living a good way of life, but the purpose is to give back to my community or give back to my family. It's not a selfish thing. My purpose is rooted in those around me and giving back, but I also need to take care of myself to take care of you, right? So those deeper kind of meanings that I could be maybe brought up in those values like Arlene was and have that in my family, but maybe not have access to some of the practices, and I could still have a protective effect, right? So how do we think about some of these things? Others that we tap into, multidimensional mastery. By the way, if those of you who are doing research, we've been looking at multicultural mastery scales. These work great predictability, very protective. In native samples, I wish people would start using them in non-native samples, because this idea of sense of mastery with the collective, I can get things done with my group, with my family, with my community, that should be protected for all humans. So let's start measuring these native specific constructs in non-native context. First Nations communities of our world have a lot to teach non-native communities, I think. Worldviews, and then also family dynamics, extended kinship patterns. How do we measure some of that? So we have measured all of those things in perfectly imperfect ways. And sometimes they work well, sometimes they don't, but we go through that cycle of interpreting with our communities. So here's an example of our community teams. Really, this is, they were doing some little exercises. Of course, they were having fun, trying to come up with what does culture mean to us, you know? And one of the things they asked us to do is, hey, we're doing this study with young adults right now. Kids in their mid-20s, young adults in their mid-20s. And we should ask them, duh, right? We have some team members who are in their mid-20s, but we did a thing called group concept mapping. Don't get lost on this. Don't get worried. It's going to be a second. But we did this method where individuals on their own could tell us what they felt living a good way of life in Ojibwe language meant. So, Minobamana's-Way, what does that mean to you? And they generated, each little dot here represents something they came up with, and it was 100 different statements that you try to whittle it down to, themes. And then they come together as a group, and they try to thematically organize the map that results from all the individual pieces that they generated. So what you can see here is from asking young adults, and I'm not getting into the methods here much, what does it mean to be living a good way of life? These were the themes that emerged. Culture was big, and what overlaid all of these were the 7 grandfather teachings, which are specific to Anishinaabe communities, but used in other communities as well. They really mapped onto these 9 domains really nicely and overlapped in various ways. So what did we think about that? Well, self-care, self-determination, actualization, community, we can measure these things, right? we can measure these things and see if how much of that is in the data that the young adults are telling us. I keep saying kids because they were adolescents originally in the study, that the young adults were telling us about. Does it have predictive validity for positive outcomes, stuff like that. So this was a really long way of conceptualizing living a good way of life, a culturally bound idea, and then moving it into measurement. We scoured the existing literature, we adapted some measures, we did what we had to do to try to come up with these ideas. So the last piece of this is the kind of the other side of the coin. How many of you have heard of historical trauma? Almost everybody. Okay, so historical trauma is this huge thing that has been written about for Native communities and other communities, Holocaust survivors, African American post-traumatic slave syndrome. These are interlaced concepts about the collective experience of policies, procedures, and government intent to of ethnocide, basically, right? So I'm not going to go into what historical trauma is, but it's big. But our community teams, very early on, right when I started as a graduate student with the projects, by the way, my uncle was the person traveling around to reservations, getting people's ideas on what they wanted to measure for this healing pathways study. That's how I got to graduate school. And the community team decided, this historical trauma thing resonates with us, but we want to talk about it in terms of the sense of loss. Historical loss, what does that mean? So we went through the actual wheel process. Did this wheel exist, like on paper? No. But the idea of conceptualizing, operationalizing, and looking at the literature and trying to walk through how we could actually do this really followed this wheel that didn't exist at the time. So first, how do we think about it? What is historical loss? Well, you can look at the literature, common measures, and think about this idea of loss or genocide or trauma. And there was stuff out there, actually. These are just a few examples. Most of you will know about Maria Braveheart's work in this region, right? She did work very early on around historical trauma response, a lot of theoretical stuff and some qualitative stuff. There were Holocaust models of intergenerational trauma that seemed interesting to our team. There's books on soul wound. I mean, this is just one example of, Eduardo and Bonnie Duran's book, but there were things out there in the literature that we could look at, but not really empirical measurements of this thing, right? Like, how do you actually measure that in a survey? So the team decided, well, we see these common kind of approaches to loss and stuff, but that's not quite what we're after. We want to tailor something more specific to our region. So the tool that was decided to be used was focus groups. And in those conversations, the goal was to identify what are the losses that you want to talk about, and what kind of emotions are solicited from or elicited by talking about that. And so the result of this was we started with these common ideas and then thought about Native populations in general and historical trauma, and then really thought about, okay, how can we actually measure, operationalize a historical loss measure? And the result was this historical loss and associated symptom scales. And it includes items like, how frequently do you think about the loss of your land? How frequently do you think about the loss of culture, loss of language, loss of children to boarding schools, loss of our elders to early death? Communities came up with these items. And lo and behold, it's correlated with everything negative under the sun in a lot of studies, but my last message will be, hold on. And I just want to fast forward. This was back in 2004. A few things have happened. First, I was hosting at our university some Maori scholars from New Zealand. And we were talking about this measure. And has anyone ever gotten to work with any Maori researchers? If you haven't, I'd highly suggest it. It kind of gives you a taste of what it feels like when Native people might get a little political power. Because Leonie said to me, that measure, I never understood why you lost the land, like you lost your car keys. It was taken from you. She was like right in my face about it. I was like, oh, good point. Good point. the way you word it could mean something, right? So and some data that just came in, we haven't analyzed it yet. We did a retest of the historical loss scale, changing the language from the traditional historical losses to how often do you think about the attack on the land, about the removal of the children, the taking of the children. Very active, like this is intentional stuff versus it was lost. So we're going to see if it changes the way it works. We also get a lot of queries, Les Whitbeck and I, on this measure, because now he forwards them all to me because he retired, but on people will say, how do you standardize this, or how do you score it? I think it's that whole brainwashing of measures have to be standardized, and you should copyright it and all this stuff. And we say, tailor it to your community, change it up, score it the way you want to. It was never meant to say whose loss is more than the other. I don't think we want to compare that. It's about, are you tapping into some construct that is of relevance as a risk factor for the community or something else? We also think about the measure and its evolution for current events. So you guys in this region, I think the No DAPL movement, the pipeline, that's a huge contemporary but yet historical legacy factor that might make its way into a measure like this. So we have recently revised and added items about mining for our region because we're losing land and we're losing waterways to mining industry. So is that historical anymore? But that's the whole point of historical trauma, right? That it's not really historical. Anyway. And then the unintended consequence, this is something I battle with Les Whitbeck about verbally all the time. Les, why did you name that first article measuring historical trauma? You're not. It's one little piece of historical trauma. Now everybody is using it. Not everybody, but people are like over-representing this one little domain of historical trauma in the literature. So once a measure gets out there, the unintended consequence, again, is replication. So it's good, and yet it freezes people from doing more creative things. So I want to end by tying all of that together. Okay, so the wheel is there. It's a tool to think about how to adapt measures. We've used it formally and informally, mostly informally, like, oh, did I cover my bases here? But something started happening, I would say even like 15 years ago with the Healing Pathways data. We would be in analytic meetings. We do them once a week. And people would bring in like preliminary analyses where they would show us things like, oh, these cultural variables are associated with worse health outcomes. And I know we're not alone in this. This happens in a lot of analytic groups. And then you start to question, well, is it true or is it the measure? Like, are we measuring something we didn't think we could measure? So the second, or that we didn't intend to measure. So the second thing that was happening with historical loss is, and this still happens, I get emails quite a bit from especially dissertation level students who are saying, oh, it correlates with better health. It correlates with positive outcomes. So historical loss is making us happy. Or, the erroneous conclusions, of course, but historical loss is related to better physical activity. Okay, but is that the message? Or is there some other underlying factor that this is tapping into? So we did write a little paper a couple of years ago talking about this interplay. And what we did was very simple regression models where we controlled for the usual suspects, and then we threw in a variable that our community teams consistently say, and I personally believe, should be pretty protective, should be pretty health promoting. And that is the spiritual piece. So our spiritual activities measure is really tapping into pretty hardcore spiritual stuff that's not like something you could just easily do, right? It takes some investment of value and time and all that. So we did this, and I'm showing you two outcomes, somatic complaints and depressive symptoms, but in the paper we have other outcomes for kids too. And across the board, traditional spiritual activities was associated with worse health status, no matter how you measured it. But as soon as you stepped in, perceived discrimination or historical loss, or both of them, that association goes away. So here's where the confounding is happening, right? A person who is more enculturated or more attuned, maybe spiritually, or more aware of our legacy as Native communities, may be more vulnerable to feeling the pain of discrimination, or maybe more aware of those losses. And so there's some of this, right? This is my fancy way of saying some of this. But you can model that, right? And this is a very simplistic way of modeling it. And on the last, in model 4 for depressive symptoms, the sign actually starts to shift into a negative direction. The coefficient is very weak, but you see it happening. So this is where I think we're getting into some trouble. We're trying to tap into both the culturally specific risk and resilience factors, but they go like this. They overlap with each other. And if we're not careful, we're going to be writing some pretty massively stigmatizing papers. And I don't think we do that because our community keeps us in check. But I will tell you, this paper was very difficult to decide that we should publish. Because this piece, you can imagine the scare that the worry that we all talked about as a community of scholars and community members, like what are people going to see? What message are they going to get if they read that? If they'd only read to there and stop reading, as many people do. But our elders on the, particularly on our Red Lake team said, no, we got to tell this story. People got to pay attention to this. Some of these activities are devoid now of what their historical meaning was. We got to start talking about it. So I guess what I'm saying is, even when we do all that conceptualization work and really thinking hard, you still can get some squirrely stuff, and the only way to really figure it out is through that community engagement wheel. Okay, so this is it. The final thing I want to say, what are some of the take-homes for me that I don't know, I hope there's at least one little nugget in all of this kind of broad stuff. I think that culturally appropriate, and when I say culture now, I'm meaning generic culture. Contextually, culturally appropriate measurement matters everywhere. And this is the groundbreaking report I told you about. If you haven't read it, it's from the NIH. It was authored by Kagawa Singer and colleagues in 2014. And I read it I was so excited when it came out, the cultural framework for health. I'm going to learn how to measure culture in better ways. And what I read and what I found out is like, wow, our native scholars are doing it way better than any other places. Like we're really drilling down, and we're really thinking about those interplays, and we're really thinking about how to do this in a mechanistic way. Like, what are the mechanisms of culture that matter? And that report really reinforced that for me. So we gotta toot our own horns, is what I'm saying. And that to do all of this work, there are frameworks. This little wheel is a framework you could use, but you know, there's other frameworks out there for thinking about how to approach these measurement issues so we don't get stuck. Because I think, especially early in our careers, we get stuck, like, oh, they're telling me I can't, or that one teacher in grad school said I had to do it this way. And so maybe maybe do it both ways, just so you can feel good about yourself, right? So you should make sure you cover your bases. And again, my biases and assumptions are, like I said, that we can offer lessons to the rest of the research world. Did anybody ever get to meet David Henrie? Has anybody heard of this guy? Sadly, he passed a couple of years ago, but you can just look at his picture and see how kind he is. And I barely knew him. I met him once. And he had a profound impact on me because he was an expert methodologist across all kinds of prevention science domains. Everyone loved David Henrie. He published amazing things. And he gave a talk to a native specific conference, NCRE, that some of you go to, about measurement. And he was talking about psychometric kind of stuff for the most part. But at the end, I said, how do you, at the time I wasn't as into measurement as I have been the past few years, but I said, how do we like ease the burden on our participants? Because some of these measures get so long and they're so wordy, and yeah, I get they're standardized, but nobody knows what that word means. And he said, I would rather, after all my years of doing measurement work, I would rather have you write a single item measure that you make up with your community team that they feel is valid and they understand than have you use some validated measure. Now, he said, I'm not all the journal editors, so good luck with that. But it freed me. He freed me to be like, oh, we got some stuff we can do. And we can do the validated stuff so we can get published, but then we can do some innovative stuff too. So I gave you one of his articles with Carlota Falk, who she's out of Alaska, or was out of Alaska, I don't know if she's still there. Increasing the sensitivity of measures to change. And this is applicable to the evaluation team here, to the prevention scientists. Really cool little article with 5 tips on how you can increase the sensitivity of measures, because if they aren't sensitive to change, they're not going to be good evaluation outcomes, right? And one of the tips he had was make it culturally valid. that will improve the sensitivity to change. So that's one little article. You could also look up his CV and read all his stuff and hopefully be inspired like I was. But I gotta say, I am not a hardcore research measure evaluation person. I like looking at some of the IRT stuff and reliability stuff and predictability stuff, but I don't get bogged down in it. I'm very practical. So again, those are my biases. If that scares you, you shouldn't listen to me. Funding acknowledgements, and that's all. So there's Rainy Lake, that's home. That's near Blind Indian Narrows, actually. So, Miigwech, thank you.